Hello everyone, welcome to our first video on the channel. In this video, you will see a step-by-step workflow of a single tooth guided implant surgery with immediate extraction and implant placement. We'll briefly cover all the steps right from intraoral scanning to importing of CBCT DICOM data to virtual extraction to 3D implant placement to all the steps of surgical guide designing to slicing for 3D printing, followed by actual surgical procedure to a 15-day post-operative healing. So sit back and enjoy. We would be using a 3shape Trios 3 for intraoral scanning, followed by a 3shape Implant Studio as the designing software. So let's get started. We start with creating a new patient file, filling in the basic details about that patient. You can either select in-house or you can select the Implant Studio at this stage itself. As shown on the screen, you start with scanning the lower arch, following the lower scan strategy from occlusal to lingual to buccal. Once you're done with the basic scanning of the lower arch, you let it optimize and you check for all the missing data that is there, and all the areas that you see in green or an empty hole needs to be rescanned. So we do that by going back and rescanning those things. Once we are done with that, we can now move on to the upper arch. We have started scanning the upper arch. The scan strategy is slightly different. We are doing the occlusal, then followed by buccal, and then comes the palatal. This is the scan strategy that we follow for the upper arch. Just like the lower arch, at this stage you will try and check for any missing data, especially in and around the site of implant that we are going to be placing. So we could see a few holes there that we scanned, and we could see that there is some buccal data that is missing, which would be important for the guide's extension. We now move on to the bite phase, where we start scanning. We are scanning the upper and the lower left bite. Once done with that, we move on to the right side. It is always recommended to record both the sides or both the bites always whenever possible. So here it snaps in position. Once we are done with this, you let it post-process and move on. We then enter the implant guide designing step inside the Implant Studio. One cool feature about 3shape is the scanning software and the implant planning software are integrated into one software, so you do not have to export the data out into a separate software, and everything happens in a single workflow. The next step is to import the patient's CBCT DICOM data. Once you point out to that direction, it will start importing the DICOM data into the file, as you can see over here. Once that is there, you hit next. After hitting next, the software automatically tells you that if you want to extract a tooth, you start marking the boundaries of the tooth, which you can see happening right now. Once you have marked that, if you want to slightly modify the margin, you can still do that, which is very intuitive, and the software does a virtual extraction by default for you. You can crop the scan if you wish to, but it's not necessary. You hit next. The next step is superimposing the intraoral scan with the CBCT DICOM data. If that's acceptable, then hit confirm alignment and you can hit next. The next step is the implant planning step. The software recognizes which tooth requires implant placement and shows a plus sign. When clicked, it lets you select the implant based on your preference. You can always select any random size and eventually change it while 3D planning the case as you go. Since we have performed virtual extraction in the past, the software places the implant in an approximate position and we can fine-tune it from there. Implant can be directly moved holding the left mouse click and moving to the desired position. Most of the positioning can be planned in the orthogonal view or the tangential view and can be checked the entire 360 degrees using the center scroll wheel. Once we are happy with the position in the bone, we can shift to the intraoral scan view for verifying whether the position is acceptable prosthetically or no. And if there are any modifications, we can go back into the tangential view or the orthogonal view and verify, and if needed, we can make the necessary changes there, and this to and fro is done until you have a 3D position acceptable from both prosthetic and implant surgical standpoint. Since it's an immediate extraction case, we want to compensate for the bundle bone loss post-extraction. So as a rule, I would like to plan my implant 2 millimeters away from the buccal cortical plate, which we can measure by clicking the scale symbol and click point A to B to know its actual distance. Once the position is finalized, we move to the intraoral scan view. As you can see, it requires little tweaking, which we have done. Once done, at this point, you go back into your other views, which was the tangential or orthogonal view, and you verify it in 360 degrees whether this is the desired position which you wish. At this stage, once you are happy with the position, you hit next. We now enter the surgical guide creation window. The first step is setting the insertion direction. Once that is set, you start marking the extent of the guide. For a single tooth implant, 2 or 3 teeth covering on either side is actually more than enough most of the times, because the surgical guide is completely tooth supported. As soon as the first and the last points meet, the surgical guide creation starts. Once the surgical guide is created, you add a viewing window, one on either side as the minimum requirement, which makes sure that when you place the surgical guide intraorally, you have some part or some place where you can verify whether the guide has completely seated into the mouth or no. The last step is addition of ID tag, which helps you identify the surgical guides when you start having a lot of guides in your practice and you want to use the same guide for the second stage surgery. In the next window, once you approve the surgical guide planning and the implant planning, you can move to exporting the surgical guide, which you save it to a destination folder where you would like to save it. After exporting, the next step is 3D printing the surgical guide. For doing that, we use a software called Chi2Box. You drag drop the surgical guide into that, and as a normal protocol, we like to orient it at 45 degrees and add support before 3D printing. Once that's done, this is the final product just out of the printer, which is then post-processed using a wash and cure unit. In the next step, the surgical guide provided by the implant company is inserted and the 3D printed surgical guide is packaged and autoclaved before use. In the next part of the video, you will see the entire surgical process in real time. If you found this video helpful, please like and subscribe, as this is our first official video on the channel and we intend to make many more informational videos like these in future. If you have any questions, feel free to send it in the comments below. I'll try my best to answer them. Thank you so much for sticking around. See you in the next one.